all the scaling, little deep pockets. First, don't do any aggressive deep scaling and root planning. It has to be done by phase wise. First, do the superficial scaling. Second, setting. First setting also, what you can do after the scaling, you can take the dye, that bucket. You can take either methylene blue और इंडोसन ग्रीन डाई जो आप एल के सीरीज में आता है. सल्कस एक ड्रॉप डालते चाहिए. तो बाय पैसिव एब्जॉर्प्शन इट कीप्स ऑन एब्जॉर्बिंग टिल द डेप्थ ऑफ द पॉकेट. After 4 minutes of soaking period, you just have to, am I visible? Yeah, you have to wait for the 4 minutes of started, no, right? Wait for the 4 minutes after for the absorption of the dye to occur on the bacterial cells and viral or fungi, because photodynamic therapy is one that you can that acts on all the three bacteria, be it bacteria, virus, or fungi. So you can ask me the question that why healthy cells are not affected, why only these bacterial cells or other micro pathogenic cells are affected, because they are coated with lipopolysaccharides. So this has got the high affinity for absorbing the dyes. So once you wait for 4 minutes, all you have to do is take the laser of specific wavelength. If you're using methylene blue, this is the methylene blue dye. You have to take this, put it in the sulcus, wait for 4 minutes, and then irradiate with 660 nanometers. Because we have got something called optical affinity for the dyes. When you're using blue, you have to use only 660 nanometers. When you're using green, Indocyan green, it's always 8 and 10 nanometers. So instead of falling into the trap of the dealer that ours is 10 watts, 9 watts, 8 watts, don't quote the watts. That's not the right question. Can you come and stand here if you're not able to see to participate? You can come here this side. Students, come here and stand at the back side so I can see that everybody see. So don't fall for the dealer's claim that sir हमारा 8 watt है 10 watt है. The right question to ask the dealer is what is your wavelength exactly, because if you're using 8 and 10, it's always no Indocyan green, right? I will be covering in detail in tomorrow in the theory hmm, period part. hmm. So once you ask the dealers, kitne, what is the wavelength of the laser, when I can use this blue, when I can use this green, then they will not be able to answer because they've been trained only to concentrate for the dentist tell bats हमारा ज़्यादा है उनसे ज़्यादा है. Is a general dentist they will fall into the 10 watts उनका 5 watt है 6 watt है. No, in 810 nanometers wavelength, all you need is maximum 4 watts for teeth whitening also. If you're using the 8 tip, it's always 1 watt per teeth. If you're using the prism, this prism, Amit, you that prism for bleaching of the teeth, teeth whitening procedures. It's always you have to multiply it by 4. That's all. Here you're using 1 watt. Here you're multiplying 4 and keeping it in 4 watts. So 4 watts is the maximum unit you will be using. You are not going to use any procedure beyond 4 watts. Why you need 10 watts, right? So these tips and tricks in laser you must know. Hmm. Anywhere you can use, except in pregnant patients, the contraindicated thyroid patients. That's what. In anywhere you can use it anywhere except for thyroid patients. Pregnancy, medical compromise you can use better also, more also, because where the drugs fail, our lasers comes in handy, right? And one more condition where lasers is contraindicated is cancer cells. Those who are having CA, because they claim that photobiomodulation will proliferate the cells. So, so it is not yet quote unquote they shown the cause and the effect. But because of this theoretical background, what we have that it proliferates the cellular regeneration, multiplication of cells. So they we treat such cases with caution. But again, as Amit sir told there, management of OSMA for oral mucositis in cancer patients, the American Academy of Oncology have made it mandatory for each and every patient to compulsorily undergo one dose of photobiomodulation before the irradiation of the prevented, prevented. Because what happens, I'll tell you. Once it is in a full stage CA, you must not do it. Just now, these are all little more which Yaugal sir will be telling you. Pre-cancerous disease, what happens if you send you to oral surgery department? They not the same. We cut the tissues and we'll while cutting the tissues we breach that basement membrane or basal lamina where you are again inviting all the cancer cells to spread into the whole body. So whenever you are in doubt of precancerous cells or in any such conditions, have 4 to 6 sittings of photobiomodulation. Your 4 to 6 sittings are not going to accelerate the CA and go into full blown, right? So if this is a precancerous lesions or conditions, you can actually make it come back to the normal biological whatever the cellular disease is. So at the first instance, don't send any patient directly for biopsy. Wait 2 to 4 6, see the cellular changes, see the changes you'll be seeing on the oral cavity. If it is a very chronic lesion, twice a week or every alternative day. If it is an acute, every day, twice or thrice also is okay. If the patient lives very nearby, what happens, ma'am? Suppose I am on a 10-day diet. I have not eaten anything for 10 days. My cellular are completely in a pathetic conditions. There will be no enough ATP production, no enough energy is there. If I give a, if somebody gives a 3 course meals for me, अभी आपने 10 दिन नहीं खाया है, अभी जितना चाहिए खा लो, नहीं खा सकते। स्लोली आप सेल्स को एक्टिवेट करना रहता है कि आप धीरे धीरे नॉर्मल से आ जाओ, उसके बाद हम आपको ज़्यादा खाना देंगे ऐसे। So whenever in the chronic lesions, give it slowly. Feed it every alternative day or every twice in a week if the patient lives very far. Whenever the conditions are acute, अभी 3 दिन हुआ, 10 दिन हुआ, 15 दिन हुआ, एक महीना हुआ, you can treat it every day. 2 दिन हुआ, 3 दिन हुआ, you can treat it twice in a day, thrice in a day. That's the basic fundamental knowledge behind the frequency of using, the duration of using the lasers, right? We have to decide the time of the patient's history will tell you how many times you have to apply the low level laser. Earlier it was called cold laser therapy or low level laser therapy. In 2008 or 9 they all came up together and used the term photobiomodulation because even LED what does, even the laser does with certain LED doesn't, it can't compete with the lasers because of the collimation and coherence of the lasers. Once the LED hits the tissues, it is not absorbed deep. Its action stops there. In laser, there will be penetration of the laser energy into the target tissues, right? So, so what you can do in such cases, if you want, suppose if you want a deeper depth of penetration, whatever energy you are applying, whatever energy you are applying, you have to apply it for a 60 seconds to 120 seconds. Slowly, it will longer days. That's the one. So it is not any rocket science that you have to master it. Within 2 to 3 days, you'll come to, if you have a basic knowledge and if you discuss some cases with, we have a group, WhatsApp group. If you want, if you have any cases, you can post the clinical photos. If you do on 5 to 10 cases, then you are on your own. That's the what we have learned from our laser who have bought it. No, they stop asking questions later because they know now how to do. How starting only you will be having little problem, right? Yeah. Any other questions? So we have a range of lasers. I will just go through this. This is called Novolace Dio. It is a combination of 980 nanometers plus 650 nanometers. and this is knowledge gold. It is a 810 nanometer plus 640 nanometer. So you can ask that if both are dual wavelength, the lesions are on the visible जो भी है या डेप्थ ऑफ पेनिट्रेशन ज़्यादा नहीं चाहिए तो 660 nanometer 640 to 660 nanometer is the laser you want to go for. Oral medicine people, most of the time oral medicine staff or oral medicine students, they would rely on, if they are not cutting the tissues, 660 nanometer will be enough for them. So if you want a little deeper depth of penetration, and if you want cutting also, so if you want one laser which does all the three jobs, you can go for a No 6 or 810 nanometers. 810 nanometers is the drug of choice for PBM, PDT, as well as cutting the tissues. That is PTT, photothermal therapy. Tomorrow I will be discussing about this in detail because we are now here for hands-on. So I'm just superficially covering it. Okay. So this we have. I mean, chalo matter. सो सम पीपल वांट्स कि मुझे ज़्यादा ट्रेनिंग नहीं चाहिए, मुझे जो ऐसे कस्टम मेड चाहिए, व्हाइटनिंग करो तो व्हाइटनिंग पे आना चाहिए, बायोमोडुलेशन तो बायोमोडुलेशन आना चाहिए, तो उनके लिए हमने वेरी नीटली डिजाइन किया है. दिस इज नहीं, सम पीपल वांट्स नहीं हमको ज़्यादा वेट चाहिए, है हमारे पास 980 नैनोमीटर्स है, सब क्लीन है, जैसे आप दूसरे लेजर में देखते हो वैसे सब सेटिंग्स है, पेरियोपिडिटी. सो यू नीड नॉट हैव टू मच लर्न, डायरेक्टली स्टार्ट द ट्रेड. अमरिंद, इसको एरर मोड. So it's ready now. So once the foot control कहाँ पे है? नीचे डाल दी. So don't see this for much longer period of time because you need to have the glasses. Laser safety parameters one of the important factor. But when you are using low level photobiomodulation, you have that of not using specs because it is always in contact mode. There will be very less of scattering of the laser, so it will not be affected much. But I prefer you wear the laser safety glass, and then start. But whenever you're using in the thermal mode, see to it that you are using the safety glasses for that. So this is 980 and 650, 810 and 640. We have what is called for oral medicine people. Again, if you are in a larger setup in clinical hospital, cancer hospital, or somewhere we are doing multiple cases in a day, in such cases you go for this only therapy and base. It doesn't cut, it treats. You can do PBM, PDT, and aesthetics. This aesthetics, teeth bleaching and all that. Yeah. So we have made it a very simple one. One, two. This is three, three, four. Start. It is in, if this light is blinking here, it is continuous, and if this is pulsed. So if I press again, it has gone into a pulse mode, and straight line matlab continuous mode. So photo biomodulation by default in these machines, you need not have to crack your head saying that अभी मैं PBM हूँ, continuous mode में रखूँ या pulse mode में रखूँ. By default it will take you to continuous mode in photo biomodulation. In photothermal therapy, where you want to cut the tissues, once you go for the 1000 watts, it will go for a continuous, pulse mode, because you need the dissipation of heat in between. Otherwise, you're going to char the tissue, right? So, by default, it will take you to pulse mode in thermal, and in photobiomodulation, by default, it will take you to continuous mode because you need, whenever you're calculating the dosage. I will again tell you in how to calculate the dosage. I will be telling you tomorrow. Uh, so if you must have heard today 6 joules, 8 joules, 12 joules. So that I will calculate on the board and let you know tomorrow how to effectively apply that calculation dosimetry for delivering the per square centimeter or whatever. So this we have simple for oral medicine people
So
and
is
large.
this battery based?
It is battery based. You
So
can
no
charge and
electric supply is
yes,
needed.
you can charge it and later keep it. You
Keep
can
it
take it any
ready.
chair to chair लेके जाओ,
Okay.
cubicle to cubicle.
So
हाँ,
portable it is. So इसकी wavelength क्या है sir?
इसका वेवलेंथ है 8 and 10 nanometers,
800.
660 and 8 and 10, only for therapy. There will be no cutting of the tissues. And then we have, अगर आप मेरे जैसे चलते फिरते डेंटिस्ट हो, कंसल्टेशन के लिए जाते जाते हो, अगर कोई आता है कि सर इनको अल्सर है कैसे करें, मैं अपने जेब से निकलता हूँ अपना औजार, सो मुझे कल टंग बाइट किया था, अल्सर था, छोटा सा अल्सर था, आई वाज इट वाज वेरी डिफिकल्ट टू मेक प्रॉपर प्रोनाउंसिएशंस, तो मैंने आईने में देखा, 1 मिनट में बंद हो जाता है। सो 1 मिनट अगर मैं 660 देता हूँ तो सिक्स 660 for 60 seconds 100 milliwatts, it will come to around 6 joules. How to calculate I will tell you tomorrow again. Okay, so अगर कोई आप कंसल्टेशन जाते हो, कोई ऐसे कोई केस आता है, ट्रॉमा आता है, चाइल्ड स्मॉल किड, ये होता है लैसरेशंस होता है, ट्रॉमेटिक फॉल जो भी है, इमीडिएटली उनको लगाओ यहाँ पे 1 2 मिनट 1 मिनट ऐसे। Light cure comes in a range of 432 nanometers. Design, yeah, that it is called, it is a laser. So this comes very handy if you have a back neck pain, मैं यहाँ पे लगा के इसे बैठ जाता हूँ, ये मुझे पेन है तो यहाँ पे लगाता
Charging is okay. Okay. Okay.
हूँ। Therapeutic, no cutting, only therapy. One question at a time. Yes, these two and one more we have no 6, that is single wavelength 8 and 10 nanometer. Right? Cost we'll discuss tomorrow. No, 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 no. Any one machine can do.
Yeah.
Some people depending on their प्रोफेशन लाइक ओरल मेडिसिन है तो ज़्यादा उनका कटिंग से ज़्यादा ये नहीं रहता, तो दे कैन टेक आइदर दिस और दिस। शौक बड़ी चीज़ है, डर्मोलॉजिस ट्रेंड में है। आपको पिंपल्स वगैरह होते हैं ना, एक ड्रॉप इंडोसिन ग्रीन या बायोमेथिन ब्लू डालो, यहाँ पे लगाओ। हाँ, इट इज इन नॉन थर्मल, इट इज नॉट हार्मफुल एट ऑल। Hamlin, as I discussed now, according to him, because I do get most of the review articles, they use one bats as a low level laser therapy or photobiomodulation, which is extremely wrong. You can't go into thermal zone and then claim it to be photobiomodulation or low level laser therapy. Wrong. I reject the articles then and there only. Anything that goes above 500 milliwatts, you are going into thermal zone. Anything that is less than 100 milliwatts, जैसे अभी ये दबाऊंगा तो can you see here 100 milliwatts, I can increase it 200, 300, 400, 500. So photobiomodulation 500 milliwatts maximum you can. Anything that goes above the 500 milliwatts you are going. I think I'm taking the lecture here only. Tomorrow you need not have to hear.
Remember
Okay.
all this, sir. So you can keep doing it 3 4 times. Also is good for us, sir.
I will again come. We'll have
This
a
is
extensive.
recorded. This is on YouTube, so we will have, so we can see it over and
Yeah,
over again.
we can have. I will come
No.
again for an extensive hands-on course also. Hmm? We'll plan it out. No problem. All good. Okay. So whitening or even in you have so many patients they're sitting on oral mucositis or any non-hinge ulcer patient comes, so अभी इनको चेयर पे बिठा के मैं एक्स्ट्रा टाइम का को अपना खराब करूँ या ओरल म्यूकोसाइटिस है, तो मैं क्या करता हूँ रिसेप्शन टेबल में, दिस इज ब्लू रेड कॉम्बिनेशन ऑफ ब्लू एंड रेड, दिस इज एलईडी बेस्ड, दिस इज नॉट ए पेट्रोल लेजर, सुपरफिशियल है, एलईडी कैन आल्सो एक्चुअली एज गुड एज। ऐसे लगा के रिसेप्शन में बिठाऊंगा तो बाकी 4 पेशेंट्स भी इंटरेस्टेड, ये क्या है, ये क्या हो रहा है। If you want to do a photobiomodulation, no need of dye. If you want to do a photodynamic therapy, definitely you need a dye. Okay.
Therapy. In patients undergoing radiotherapy, can we use lasers to treat the complications such as oral mucositis and all?
Definitely. That's what I say.
No,
American,
ma'am, I was not there. I was
you're
in
not there.
posting, sir.
The American Academy of Oncology has made it
I
mandatory
was not
for
there.
each and every patient to compulsorily go for a photobiomodulation for prevention of oral mucositis before irradiation for those cancer patients.
Okay, sir. Thank you.
When there are whenever there is infection, bacterial, viral, or fungi, use a dye. When you want only the cellular modification or biomodulation, you can do no need of any dye, right? All good. So, in case you want to understand about these, we have three: 200 microns, 300 microns, and 400 microns. 400 microns you can use only in case of surgical cutting of the tissues, crown lengthening, operculectomy, gingectomy, all these. Anything biopsy. So when I will just show you. These are all 300 microns, where it can be used for pocket elimination or pocket debridement therapy. Yes. So whenever you are going for a periodontal debridement, always use 300 microns. Whenever you want excision of the tissues or cutting of the tissues, go for 400 microns. And whenever you are using, you want to do a photothermal or photodynamic therapy in endodontic canal, go for a 2 millimeter. Very easy to understand, right? Yes. Fenestration decisions, these are all alveolar bone. You are going to prime the tissues. You are making them ready for cellular regeneration. You are not going to augment that soft tissue. Again, that will come in the periodontal part. 8 mm or 3 mm. This is 8 mm tip. 8 mm. Yes, yes. You We have something called for auricular medicines. You can go for a 3 mm or 8 mm. Anything you have at your disposal, you can use it. How to use it? No, you will be having that RVG sleeves, no? जब तक वो गलेगा नहीं तब तक यूज कर सकते हो. You can use for average 3 to 4 patients per tip. So if the cost is around 500 rupees, so you can use 150 rupees per patient, 1050 per patient. Root canal is ज़्यादा देर जाएगा. Whenever you are doing root canal therapy, see that you are always before obturation, always partializing the canal or auricular. Yeah, because patients demand कि TMJ के लिए कोई है कि because you need to understand, go back and understand the science little back. If you can, you TMJ is little deeply seated, right? So you want the energy to be go in very deeper into the tissues. So if you're using that auricular, sorry, that yeah, TMJ cluster, that will be like this, 10 mm. 12 mm. So the energy delivered will not be the same as what you deliver the energy here. Just we do have that we have that in knowledge. What happens? सर आपके लिए हमारे लिए आपके लिए टीम जे हैंड पे ये भी देंगे एक्सेसरीज अरे वाह ये तो एक और एक एक्स्ट्रा दे रहा है साइंस को समझो मैं हाँ सो आई इफ आई क्लेम yes advantages of root canal of doing laser therapy right so the studies which PubMed articles which they say that if you do it the sodium hypochlorite irrigation the accessory canals what how much it can reach is 50 to 100 microns deeper accessory canals right if you do it through laser the dyes studies have shown I will quote the studies also in the art if you make a WhatsApp group for this I will quote and it has gone till 1000 microns it goes till 1000 microns accessory canals so all your pathogenic bacteria including E. fecalis which is the most resistant organism in endodontic canal even that will have an instant kill no side effects at all कोरोना में तो मुझे बोला गया कि मेथिलीन ब्लू भी देते थे पीने के लिए है राइट if multiple voices are there no it will be very hard for them to excuse me come back खत्म हो जाते हैं yes 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 minor apical foramen you want to say and make it very single voice because it is being recorded everything should be heard there also if multiple voices are coming the person sitting there will be confused little raise your hands and ask questions that will be better that will be audible to them also so you are speaking of the minor umbilical foramen so what we are doing we have something called in knowledge this one specialized endodontic tip which has got 70% lateral emissions and 30% frontal emission we have patented it nobody can copy from us so
Laser.
endo laser
And
knowledge endo what happens there you have 70% lateral emissions and only 30% frontal emissions where the other lasers are fully concentrated at the front there are chances of more charring of the tissues in the apex of the teeth than this endodontic laser one second you are not keeping the laser exactly till the apex you are keeping at least 2 to 3 millimeters short of the laser so that the laser's energy will be till the apex and in case of sinus don't always use only the laser tip go for a photodynamic therapy induce 1 or 2 drops of dye and then irradiate so that the bacteria which is hiding there E. fecalis or any organisms that will get coated and your light is enough to kill those bacteria whereas as I told 50 to 100 microns of sodium hypochlorite versus 1000 microns of photodynamic therapy the choice is yours choose your heroes that you want yes sir Mike
When we are using for TMJ pathologies, how,
when you're using
when
what
we are using laser for TMJ pathologies,
TMJ
TMD
yes
basically,
yes, yes.
temporomandibular disorders, how come there will be penetration? Generally, they go very superficially, no?
Who will go superficial?
Lasers.
No, sir. That the TMD part, Dr. Yagal sir will be covering in detail because we have 1 hour session on only TMD and craniofacial this one. That he will make it very clear for you how it is going to have it deeper because what the other dentists were taught of only seeing the TMJ point here one and irradiating with either 8 mm or 3 mm in a particular direction which Dr. Evans will be telling you in detail. One will be there, second will be from this one, and third will be intraorally. So you are making the laser energy attack from all the three sides. That we'll again discuss after Dr. Chandrasekhar Agarwal's class. If you have any questions, you can again we'll come back to that. Right? We have 1 hour session only on TMD. employment. So please don't miss the classes tomorrow. If Chandrasekhar Yakul's flight comes, you will be the most fortunate person. Yes, got it? Okay, that's good. So again, we'll come back to that question, sir. Yes, take the mic.
Is there a time boundation till the laser will stay at particular tissues? Means for 5 minutes, 10 minutes. We have given it for 1 minute.
We speak in the language of how many joules has to be delivered for a
Okay.
definite for a particular condition. Either it is 6 joules, 8 joules, 12 joules. Depending on that, we make the calculations, which I will be explaining in detail tomorrow morning. How to calculate the dosimetry is very very important. Right? Any other questions? Okay, let's move to the next part of the laser. So this is Misty Aster. What we have. This is 24K gold. So what happens? These are all teeth whitening agents. What happens in teeth whitening agents? Usually, you must be using Polo Office or hydrogen peroxide, very high concentrations, 35%, 40%. The patient then goes to the home and sits like this. This is the most common uh, side effect of using hydrogen peroxide in such a harsh concentration. Please don't do that. You can always use carbon peroxide. The patient may not appreciate it the first time. If you use twice or thrice, you will be doing a favor for the patient by not destroying his dental tubules or going that hydrogen peroxide in the pulp. The mechanism of action in one sentence, because the hydrogen peroxide got a molecular weight less than the carbon peroxide. So less than the molecular weight, it is very easy for them to enter the penetration and cause damage to the enamel, dentin or pulp. Right? So always use lesser concentrated hydrogen peroxide or go for the carbon peroxide. That is, I got little higher molecular weight that doesn't penetrate much. Teeth whitening, the advantage of using knowledge gold is carbon peroxide is you need not have to have any gingival barrier. That is the biggest headache in teeth whitening. Little miss here and there, your gingiva again will be have got a whitish appearance, aesthetically unpleasant for the next 3 days or 5 days, whatever. So the patient will be cursing you for those 3 to 5 days. Even a teeth whitening area, मेरे मसूड़े भी गए. इधर गए. So all you have to do is first do the scaling, because once you have acclimated the plaque on that, there is no drug in this world that can breach the plaque. Not even chlorhexidine, that is a gold standard, right? So how can this reach when you have plaque there? So do the thorough scaling, through cleaning if you want, but don't use it on the roots. If you do the thorough scaling, polishing is very very important, because you are priming the enamel to receive this agent. Then only you can have beautiful results, right? Only after, be it a hydrogen peroxide or anything, see that you do the scaling and polishing, the first step, and then only go for any whitening agents. This you have to remove it like this, and then press it on the teeth. Uh, four whites with the prism. If there is only one teeth to be done, use 8 millimeter. This one white, this one into four whites. Very simple. Wait for 15 minutes. Take a composite brush, डिस्पर्स करो उसको, उसके बाद फिर से एक बार ग्लेज करो, फिर 15 मिनट बैठने दो. For 24 hours, no pigmented foods, no tea, no pigmented vegetables, nothing, no dal made up of turmeric. Yeah, all this has to be applied for. That depends upon the religious beliefs and not to have customized. We can customize the diet for them. Is- For single teeth, 8 mm. For 4 teeth at a time, who is going to if the patient comes for at least from premolar to premolar, the patient expects you to do the bleaching, right? So better if you want to save the time, go with the prism.